Hello, thank you for picking up one of our NARCAN kits here at Coconino County Health and Human Services. Our opioid overdose prevention program offers these kits for free, so feel free to come grab one should you might need another one. Our kits look just like this. Inside every kit, there are 2 doses of the nasal naloxone spray. So naloxone is the medication name and NARCAN is the brand name. Naloxone can come in a number of different ways, but this is the nasal spray. We also have a CPR face shield for performing CPR, as well as our instruction and resource guide. All right, so I'm going to take you through the 3 steps of how to respond to an opioid overdose. If you suspect that someone is having an opioid overdose, you're going to want to try to wake them up. The first sign that's going to alert you is that the person's going to be asleep or unconscious or not responsive. It can look that way, so you're going to want to investigate further. You're going to want to gently tap their arm, their leg, or their shoulder and shout, "Are you okay?" While you are trying to wake them up, check to see if they have other signs and symptoms of an opioid overdose, including small pinpoint pupils, breathing really slowly, or agonal breathing, which can sound like a gurgling, gasping, or snoring sound, or they might not be breathing at all, depending upon when you're responding. They might have blue, purple, or gray skin, lips, or fingernails if their body's not receiving oxygen. It's just dependent upon the color of the person's skin. And they might have a slow heartbeat or no pulse at all. Again, this just depends on what time you're arriving to the scene. If the person is not responding to shouting and is still not responsive, you're going to want to do a sternum rub. To do that, you're going to put your hands in a fist and raise your center knuckle just a little bit, and you're going to want to rub really fast and hard on the person's sternum. This inflicts a stimuli that should wake them up if they are just sleeping. If they do not respond to the sternum rub, you know something is wrong. It is recommended that you administer NARCAN even if you suspect an opioid overdose, if you suspect it, even if you're not sure. It is a safe medication that will not harm the person if they're experiencing a different medical event, such as a stroke or heart attack. So after you've checked the person, they're still not responding, you're going to want to move quickly to step 2, which is call 911. You want to wait to administer the NARCAN and just call for help and get EMS on the way should they be needed for another situation. Also, individuals do need care. NARCAN can last 30 to 120 minutes, just depending upon the individual. So it's always recommended to call for help. They also can talk you through how to use the NARCAN if you need guidance on the scene. When you call 911, please tell them that you're calling about a medical emergency, that someone is not breathing, and provide to them your specific location. Just so you know, NARCAN is covered under the Arizona Good Samaritan law, which means that you cannot be held liable for providing to someone in an emergency should they have an adverse reaction. There's another law called the Arizona 911 Good Samaritan law, which states that both the person who is overdosed and others present responding to the scene of the overdose cannot be charged with the possession or use of an illicit substance or for having drug paraphernalia. We think this is really important information to know and to share, since people are often scared that they will get into trouble if they call for help, and so they don't call for help. Now that you have EMS on their way, step 3 is to administer the NARCAN. Ideally, the person is laying flat on their back with their head just slightly tilted up to open up their airway. If you find that the person is in a different position, such as sitting up, and you don't feel comfortable lying them down, you worry you might injure them further, please do not move them. Continue the process of caring. Don't stop. You can still administer the NARCAN. The next step is 99% of responding. All you're going to do is take out one of the 2 doses of the nasal naloxone spray. You're going to peel back the foil and dump the NARCAN onto your hand like so. You're going to want to pick it. I'm using a demo device to show you. So you're going to want to pick it up just like this. There's 4 points of contact you can have. 1, 2, 3, 4. And this is recommended so that you don't have your finger on the plunger. You want to make sure that the medication is not dispensed until this is in the nozzles in the individual's nostril, because it sprays really quick and dispenses all of the medication at one time. So what you're going to want to do is insert the nozzle up the person's nose until it hits your fingers. Your fingers are on either side of the nozzle to tell you how far to put it in, as well as to help seal off the nostril. Again, make sure that the person's head is tilted up if you can, and press and hold that plunger. You're going to push it all the way up and hold it for just a few seconds, and it's a single dose, so then you can throw it away. So there's a few ways the situation can go from here. Narcan typically takes about 2 to 3 minutes to work, but it could work sooner than that. The person might wake up quickly and be quite energized. There's been reports that people can be really confused, overwhelmed, potentially getting aggressive. So what you're going to want to do is tell them what happened, encourage them to stay and wait for help, and let them know they're not going to get in trouble with the law. The other way this could go is that the person might be feeling really ill. If the person's a regular opioid user, Narcan puts them in withdrawal. So if they're vomiting or spitting or sounding like they're choking, please put them in the recovery position as so. You can pull one of their arms and one of their legs over to the side to make sure that they're on their side so that they won't aspirate if they are vomiting. Again, tell the person what happened, let them know help's on the way, that they're okay, and that you gave them the care that you did. And then the third way the situation can go is that you dispense the first dose of Narcan and the person does not wake up. What you're going to do is, for those 2 to 3 minutes while you're monitoring, you're going to want to do CPR to the best of your training. We know that some CPR courses do not teach rescue breathing now. However, we do recommend doing rescue breathing for an opioid-specific overdose. It is the gold standard of care. So take out your CPR face shield and place it on the individual's mouth, just like a regular mask. You can wrap it around their ears. You're going to want to make sure you can read the words in the proper direction and that the thicker part of the valve is in the person's mouth so that you're able to blow on the other side. You're going to want to hold their chin up and blow into their chest into their mouth until their chest rises and falls. So do this for a couple of minutes, and then you're going to want to dispense the second dose of Narcan. So again, you're going to want to take it out of the foil, hold it like so, and you're going to insert it into the person's nostril. You can do the same nostril or the other one, it doesn't matter, and press the plunger, and you've dispensed the next dose. Now, you're going to want to continue this cycle either until breathing is restored and the person's awake, help arrives, or until you run out of Narcan. So, when help does arrive, fill them into the situation. They will have more naloxone if the individual is still not breathing and you are out. So just know that they will be able to provide that. So make sure that you stay with the person no matter which outcome that the situation results in. Make sure you stay with the person and transfer the care and inform the medical staff on what care you gave before you leave the scene. You have just responded to an opioid overdose to the best of your ability. Please give us a call on this phone number here on the bag if you do utilize one of our kits. This is really helpful to us retaining our funding. So please give us a call if you do use the kit. The last two pieces of information I want to share with you are about Narcan expiration and storage. So the expiration date, and which is in month and date form or year format, is on the top of the box in a black box. I will tell you that expired Narcan is safe to use for years beyond its expiration date. It will not harm the individual, but it will be less effective potentially. The other recommendation is for storage, that you store your Narcan at room temperature. However, there is a study that shows that it does remain chemically stable if it's frozen and thawed out and exposed to high heat. So don't be afraid to use it if it has been exposed. And we recommend keeping it wherever you're going to have access to it. And if that's in your car, then we'd rather have you store it in your car than not store it at all. All right, if you have any other questions or want further training, please reach out to us at the Opioid Overdose Prevention Program. Our email is prevention, prevention, @coconino.az.gov. Thank you so much and stay safe.